The White Bear Area Chamber of Commerce and On Location TV19 are proud to present Your Business Matters, dedicated to your business needs. The White Bear Area Chamber is a nonprofit business organization serving as an advocate for the White Bear area and its business community. Now, here is the Executive Director of the White Bear Area Chamber and the host of Your Business Matters, Tom Snell.
Welcome to Your Business Matters, brought to you by the White Bear Area Chamber of Commerce. Each month, we interview community leaders and local business owners so you can be informed about the developments in our community. Today, I am pleased to welcome Craig Elsey, the System Pharmacy Director for HealthEast. Craig and I will discuss the impact shingles has on older workers and what can be done to limit the impact of this awful virus. Craig, thank you very much for joining me today for our television program.
Thank you. I appreciate the invite.
Yep. There are some issues I want to bring up related to the shingles virus. And I wanted to talk about this because there are vaccines, or there's a vaccine that can help limit the danger of this virus. And the first thing I want to ask you about shingles is, what is it and what does it do to a person once they get the virus? How do they get it? And who is susceptible to it?
You bet. So shingles is actually caused by the chickenpox virus, the same virus that causes chickenpox.
So if you have chickenpox, you can get shingles?
If you've had chickenpox, which most people have been exposed to it, then you already have the virus inside you that can cause shingles.
Okay.
So as we get older, our immune system tends to decline a little bit. And that's typically around 15 years old that this virus that's actually stored inside the nerves of our body, that's where it's sort of lying dormant, and our immune system's keeping it in check. As we get older, typically 50 years or older, that virus can reactivate and it shows up as shingles.
Okay. And what are some of the effects that shingles can have on people?
Well, shingles typically shows up as a rash, a very painful rash. Typically it's located on the abdomen. Sometimes can be up in the face and around the eye. It's generally follows a kind of a particular nerve path around the body, so it's normally in one area of the body. It's not the whole body, but a specific area called a dermatome. It follows this nerve pathway off of the spine, but usually a rash that covers a particular area, and can be very painful.
Very painful. And now what we're going to focus on basically older workers, people that are still in the workforce that are under 65 years old, people that don't have Medicare yet. So we're looking, I think, at that age group maybe from 55 to 65 years old. And those are people that can be susceptible then more to shingles, I take it, because of their immune system issues.
So typically, as I said, around 50 years old is when the virus is kind of the incidence of it increases fairly dramatically. The literature varies a little bit. Literature shows that after 50, you're susceptible, and a vaccine is effective in preventing that. The current guidelines from the federal government say at 60 years old is when you should get it, but that they're actually reevaluating that right now because giving it earlier obviously is still preventing illness and lost work time.
You know, I want to get back again to, so you're talking about older workers, I want to get back to some of the most debilitating aspects of shingles. Can it cause major problems? I mean, you said it's a painful rash, but what does that mean, a painful rash?
So,
what can happen to somebody that really gets shingles in a bad way?
So shingles, obviously, as we've said, is very painful enough that you typically will miss work from that while you have it. It's actually in the nerves and causes significant pain. The rash is also typically has some blisters and is infectious at that point. So they're called vesicles. So you can be infectious to others, transmit it through through that rash, or even through fluid contact with other people.
So other people can get shingles from you?
Yep.
So it's contagious.
Well, you've already got it in you, but
Right.
you can potentially, inoculate others. So
wow.
it is something you would want to keep covered and prevent. The other, I guess, aspect that you were talking about, besides it just being painful, that rash typically lasts a week to 10 days for most people. We do have antiviral medications that can shorten the duration of that rash, and that pain can maybe decrease the pain a little bit if caught early. So if you notice the rash or the pain early, get an antiviral treatment. But beyond that, then, there are some long-term events. About 10%, 5 to 10% of people can have called post-herpetic neuralgia, can have a long-term pain. Well, that's even after the rash goes away, it can still hurt, and hurt significantly for months to years in some people. And that's in about 5 to 10% of the people that get the rash can have pain beyond that. Now, getting the antiviral treatment may or may not decrease your likelihood of getting that, but it's certainly a potential for long-term pain, not just the one-time pain.
Let's say you're an employer.
Yep.
And you have a business with several hundred employees. Why would it be, what are some of the reasons that it would be important to encourage your workers to get vaccinated for shingles, the ones that are within that age group?
Yep. So obviously we have a vaccine that is fairly effective. It's over 50% effective in preventing the rash on the vaccine. It's 2/3 effective in preventing that long-term, so 67% long-term for that neuralgia, the long-term pain. So obviously when employees get this infection, they're going to be out of work, and potentially be out of work for not just a couple of days, but for a week to 2 weeks. And with this long-term pain, you can have a percentage of your employees that are out for potentially months, won't be able to come back to work. So really, a vaccine that can prevent that is, I think, a very good idea. It's a good common sense preventative that's worth doing for most people.
Sure. And it can be costly.
Yeah.
And now, when we talk about the shingles issue, what percentage of people that are eligible to get the vaccine in that age group, again, we're talking about older workers, that actually take advantage of getting a shingles vaccine?
As far as I'm aware, it's less than 30% right now, so only about a third of people that are eligible and are in the risk category are getting the vaccine today. I think I saw 25 to 30%, so certainly not. This isn't a vaccine unlike maybe flu vaccine or pneumonia vaccine that's pretty common. Shingles is probably not as well known, and the vaccine's relatively new, and people that could be taking advantage of it aren't
taking advantage of it. What may be some of the reasons that if you've only got 30% of the people that are getting the vaccine and it's fairly effective, which you mentioned, it can cause long-term damage. I've read that some people can even go blind. They get shingles.
Correct.
It would seem to me to be kind of a logical thing to do to get the vaccine.
Yeah. So I think that a couple of reasons. One is lack of education. So I think this program's certainly helping that educate people. I don't know that people are as familiar with either shingles or the vaccine's available, so asking for it. I will say I just had my physical the other day. I haven't had the vaccine yet. I am over 50 now, and I forgot to ask for it, and I'm a pharmacist that's promoting this, so I forgot. So I think that's part of it, is just education. Second is, it is a vaccine that right now is a little more challenging to get covered by your insurance. So depending on your age and your insurer, the coverage varies. So I think they're, again, back to the education, how to get this vaccine. People are going to need to ask for it and maybe navigate the healthcare system a little bit. So I think that's our job, to help people with that.
People do that, and so when people do get their physical, then it's important to ask for that and to see what they can do to make sure that the shingles vaccine is taken into place. And again, I want to emphasize that this doesn't just affect people. It's a good thing to do, but it also affects workforce issues.
Agreed. You bet.
Yeah, and I think that's a real important aspect for people to understand.
You bet.
So we're going to take a brief break, and I want to mention to please check out the White Bear Area Chamber website to find out about future Chamber community activities. With me is Craig Elsey, Systems Pharmacy Director for HealthEast. And again, want to ask you some questions and again about the shingles issue. I want to talk a little bit about cost. You mentioned earlier that people as early as 50 might want to consider getting a shingle shot. These are most people that are 50 years old are still in the workforce. But you mentioned that the CDC, which is the federal government agency that oversees health issues, recommends 60.
Yeah.
What is the reason for that and the discrepancy of a 10-year span?
I think it's just that they haven't, because this is a relatively new vaccine, they're still trying to figure out who the right population for it is. The vaccine is somewhat expensive. It's the cost of the vaccine is a couple $300, $250 to $300. So from an insurance perspective, the insurers, many of them are paying that. What is the benefit of getting the vaccine and paying for it from a population standpoint against the cost to the healthcare system? So I think they're still working that out, but I'll say many private insurers do cover the vaccine. Obviously paying for the vaccine generally will be cheaper than paying for an emergency room visit for antibiotics.
Shingles,
The antibiotics to treat this in many cases are about that same price, $150, $200 for a course of antibiotics to treat it. So is it cheaper to pay the vaccine than to pay for treatment?
My understanding too is that a number of people that have private insurance plans now can get covered by the vaccine without having to come up and pay a deductible. Is that correct?
I believe that's the case. Definitely something you'd want to call
and check on to see if that
insurer.
might be something that is available to you.
And if there is, it may be within your copay or your deductible. But in general, insurers pay for vaccines because they know that, as you mentioned, some of the severe consequences, the eye damage, and even some skin scarring from this disease, it's still cheaper to pay for the vaccine than it is to pay for treatment.
So I want to get to again to some of the cost issues for employees and for businesses. Earlier in the interview, we mentioned that I think 1 out of 3 people that has had chicken pox will come down with shingles. And according to the federal government, 1 million people a year get shingles. And we've got this vaccine that can treat it and in many cases stop this virus before it has an opportunity to impact an individual. The question I have is the cost to business for an older employee. If you've got 1 million people, that means a substantial number of those folks are probably within that 50 to 65-year-old age group, since they're the ones that are most susceptible to get shingles. Is that correct?
Yes. So I believe actually the incidence is closer to 10 to 20% over the lifetime. But
Yep.
that is increasing as we are a population. We're getting
Okay,
older.
all right.
Both we're aging and we're living longer. So our over the course of our lifetime, the chance of this infection affecting us is growing. So about 10 to 20%. But that means that many of us either have had it or know someone who's had it. If
Yep.
we're over 50. So from an employer standpoint, certainly promoting this from a healthcare perspective to your employees to prevent lost work days and having to obviously pay for sick time, vacation time is a cost to the employer. The working with your insurance plan to make sure this is covered,
Sure.
that this is a covered benefit for your employees would be a very good idea. So
Are there any instances that you're aware of that where there's been a campaign to encourage employers to get their employees to take a shingle shot as a way to help with their health care costs?
I haven't been aware of that.
Okay.
Actually, partnering with the White Bear Lake Chamber of Commerce is the first time I've heard of this kind of campaign. We've certainly done this with influenza, in the past, and have done it with pneumonia vaccine to some degree, but not for shingles. So
It's
this
an
is fairly new.
interesting
Yep.
concept. So
Yep,
we
I
get
agree.
large employers now. Healthcare costs, and I want to kind of keep this to an issue of cost containment too. Somebody comes down with shingles. They're in let's say you work for a company with 100+ employees. They come down with shingles. Let's say you're self-insured. And by self-insured, that means the company takes on a lot of the responsibilities for covering the healthcare costs. So somebody comes down with shingles. They're self-insured. I think I read something like the average person with shingles misses something like 290 hours of work.
Yep, so that wouldn't surprise me. That number I think is probably very accurate.
Yep.
You're going to be out for a couple of weeks at least, and then there are going to be a percentage that are going to be out significantly longer than that because of the long-term effects. So.
And I also read someplace that this is from 2006, so the costs have gone up probably dramatically since then. That hospitalization for shingles, this back in 2006, could cost as much as $7,000 for a person.
Yeah, exactly. So certainly within looking at that, then vaccination is certainly a cost-effective way to prevent those costs.
And I would assume then that if you're a company that is self-insured, maybe that a lot of these costs then go on to your cost for insurance. And even if you're not, and they look at your group for insurance standpoint, and a few people get shingles and it costs thousands and thousands of dollars, it's going to affect the bottom line of what you pay for health insurance. Would that be an accurate statement?
No question. Yep. Each year, employers have to go back to their insurance and their cost for they're going to pay for premiums, or the employer costs for those premiums are going to be based on what your prior year costs.
So it may be a financial benefit for a company or for an employer to take a look at their employees and at least encourage older employees to go out and take advantage of opportunities to get a shingle shot in order to help control their future health care costs.
You bet. A great idea.
Yep. Well, that sounds like a real winning combination to help and to get things moving with a campaign that would be very, very important to our community.
I agree.
Now, on the shingles issue, do you see any future things happening within that area? Any future potential vaccines coming up? Any medications that some people might be available for employees and employers?
Yeah, so there is a new vaccine being developed by another, currently Zostavax, a Merck product, is the only available vaccine. There is a new vaccine that is scheduled for release, we believe, sometime this year, so there will be potentially a second vaccine available. The current vaccine is a single shot. The new one that's coming out is potentially 2 separate shots, but maybe more effective. So, however, I don't know that right now. We know, so certainly we're recommending people that I would say, take advantage of the available vaccine, but there may be further options within the next year or so.
Yeah. Well, listen, it was a real pleasure to have an opportunity to talk to you today, and I want to emphasize that there is a real need for people in business and folks that have their own private insurance plans to really take a look at what is available and get your shingles vaccine as soon as you possibly can.
Great idea.
So, if somebody is interested in contacting HealthEast to get more information about the shingles issue, who can they contact?
So I would say your best point of contact is going to be your primary care provider.
Okay,
Your physician should be the one that can help guide you in this decision. HealthEast, certainly, HealthEast clinics and our primary care providers are happy to help both guide patients and help provide the vaccine where appropriate. So.
Okay. Well, thank you very much, and thank you, Craig Elsey, for joining me today. I'm Tom Snell. Thank you again for watching Your Business Matters.
You've been watching Your Business Matters. For more information on this program or the White Bear Area Chamber, visit whitebearchamber.com or call 651-429-8593.